Hello, dear listener. You are tuned into WellsRadio 89.3 FM, your preferred awesome radio. I'm reaching you live from Wells Broadcasting House along Galafia Avenue, Oluyole Estate, Ibadan. On that note, I want to welcome you to another episode of The Radio Doctor. This is where we delve into the world of medicine, health, and wellness. On this show, we explore medical facts, we debunk myths, and empower you with knowledge to live a healthier life. I'm your host, Dr. Tobiloba, and together we'll navigate the fascinating realms of healthcare right here on your favorite radio station, Wells Radio 89.3 FM. And of course, if you have any health concern you'd like us to discuss, please feel free to reach us on our email, wellsradiodoctor@gmail.com, or you send a WhatsApp message to 0915 4999 893. I take that again, 0915 4999 893, and rest assured that we will properly examine your thoughts and health concern. Again, welcome to the Radio Doctor. I am your host, Dr. Tobiloba Ojo, also known as Daddy Ojo. Ẹ káàbọ̀ padà sí orí ètò yín, ètò wa, ètò dókítà orí Radio Doctor. Lórí ètò yìí láti máa ń sọ gbogbo nǹkan tó jẹ mọ́ ìlera ara. A máa wò ní gbogbo ọ̀nà ìlera ara gbogbogbò. Tá ṣe lè wò kíní báyìí ló yẹ kẹ́ ṣe o, kíní báyìí ló yẹ kẹ́ má ṣe o, nǹkan báyìí ló ń fa irú àìlera báyìí o, nǹkan báyìí ló ń fa ìnira ní ibi bíbáyìí o. Gbogbo ẹ̀ la máa ń sọ ní orí ètò yín, ètò wa, dókítà orí rédíò. Èmi ni màá máa sọ gbogbo nǹkan tó máa ràn yín lọ́wọ́ láti wà ní ìlera tó péye. Orúkọ mi ni dókítà onímọ̀ ṣègùn òyìnbó Tobiloba Ojo. Gbogbo nǹkan tó jẹ mọ́ ìlera yín la ó máa sọ. We have something so important we want to discuss today. Something so vital. You'll notice that when we discuss something on this show, anytime we discuss something on this show, we try to follow up with something even critical, even more critical. We keep building on episodes one at a time, and we keep empowering you with information that will better your health, that will better your life. And today we'll be discussing something so vital. But first of all, I would like to say a big shout out to Dr. Tete Yvonne. She's a listener from Cameroon, and she celebrated her birthday yesterday, and she's doing amazingly well, even with publicity of healthcare, even in our space there in Cameroon. And also, we'd like to thank also the people that have been sending feedbacks concerning their health. For example, someone sent a blood tests for interpretation. It was like and what do you think about this? Sent something, I've done this test, I've done that test, and he sent one on full blood count, malaria parasite test, and he sent also one there was also the request for genotype. And what I just wanted the person to know is that as much as possible, this is a radio show where we'll enlighten you on this. And of course, we've taken that into cognizance. We've seen your result, and our conclusion is it will be best you get treated, because the investigations were showing some things that warrant you to be treated. Nǹkan tí mo sọ ni pé à ń dúpẹ́ lọ́wọ́ gbogbo àwọn tó ń tẹ àtẹ̀ránṣẹ́ sí wa pé à ń gbádùn ètò yín o, ìbéèrè kan àbí òmíràn lélẹ̀. Èèyàn kan tiẹ̀ sẹ́ndì test kan sí wa, ó ṣe full blood count, ó ṣe test malaria, ó ṣe test genotype, ó fẹ́ mọ̀ kí ni nǹkan tó wà ń bẹ̀. But lákòópọ̀ nǹkan tá a máa sọ ni pé nǹkan tó wà ń bẹ̀ ni pé ẹ máa need àti gba ìtọ́jú tó péye, nítorí pé àwọn èsì àyẹ̀wò yẹn ó nídìí kẹ́ gba àwọn oògùn kan. Bẹ́ẹ̀ àdẹ̀rẹ̀ máa sọ pé oògùn báyìí nìkan ní kẹ́ lò, oògùn báyìí, nítorí pé gbogbo káàkiri àgbáyé wọ́n ti ń gbọ́ wa pé àdẹ̀ máa pe orúkọ èèyàn pé ẹni báyìí oògùn báyìí ló yẹ kẹ́ lò. But test tẹ̀sẹ̀ǹdì sí wa á rí, àdẹ̀mọ́ pé nǹkan tó yẹ kí ẹ tètè sùjá ni nítorí pé àwọn test yẹn ó ní ṣe pẹ̀lú pé ẹ nídìí àwọn oògùn tó máa jẹ́ kí ẹ tún padà sí ìlera tí ó péye. Ṣùgbọ́n nínú orí ètò yín ètò wa a ó máa sọ nǹkan tó kẹnu, nǹkan tó really ṣe kókó tó ṣe pàtàkì fún àwọn aláboyún. Púpọ̀ nínú àwọn aláboyún ni ò mọ nǹkan tá a fẹ́ sọ̀rọ̀ nípa èyí. A ó sì máa fẹ́ kẹ́ bá wa ká lọ tá a ṣe máa sọ gbogbo nǹkan tí ó jẹ mọ́ ìlera aláboyún àti ọmọ inú tó ń di ọmọ tí wọ́n ń bí. So what we'll be discussing today is something so vital. In fact, many people don't know about it. Yes, I can boldly say many people don't know about it. Whenever we say things about pregnancy, people only think, oh, malaria in pregnancy, people only think anemia in pregnancy, people only think hypertension in pregnancy, or maybe diabetic in pregnancy. But many people don't talk about Rhesus isoimmunization. So that's what we'll be discussing today, Rhesus isoimmunization. So what is Rhesus isoimmunization? Rhesus immunization is also called Rhesus incompatibility. Some also go further to call it Rhesus disease, and is a condition where there's a mismatch between the blood types of pregnant women and our fetus regarding the Rhesus factor. So what is this Rhesus factor? For example, they will say someone is blood group A positive, A negative, AB positive, AB negative, B positive, B negative, O positive, O negative. That ABO is concerning the AB grouping system, but that positive or negative is what we call the Rhesus factor. That is when they say O positive, that means the person is O Rhesus D positive. So we'll be talking about this Rhesus factor, this Rhesus D positive factor. I will not just be talking about it in isolation. We'll be talking about what abnormality can happen in this condition that can affect the health of the mother as well as health of the baby, and even can cause a problem with fertility later in life or giving birth to stillbirth. So this condition can have a very serious implication for the health of the fetus, ranging from mild anemia, which is like low blood level in the baby that is even in the womb, to severe complications such as fetal eye drops, that is a baby swelling up, or even having a stillbirth given to a baby that is not alive. And to effectively manage and prevent these bad conditions from happening, we have to have the knowledge about Rhesus isoimmunization, and we should understand the types, the forms, the causes, and what are the management strategies we have. See, gone are those days that you don't know your blood group, you don't know your genotype. Those things are things of the past. Now you must know both your blood group and your genotype. Of course, we've dealt with sickle cell disease, and today we'll be dealing with Rhesus isoimmunization. That is, when they say Rhesus positive, Rhesus negative, how does it affect a baby? How does it affect a mother? Yes, that's what we'll be discussing. Nǹkan tí mo ń sọ ni pé a ó máa sọ̀rọ̀ nípa nǹkan tá à ń pè táwọn olóyìnbó ń pè ní Rhesus isoimmunization. A mọ̀ pé gbogbo nǹkan tó jẹ mọ́ ìlera tó péye nínú aláboyún, wọ́n ní ìdá tí mọ irú ẹ̀jẹ̀ wọn. Yes, kíní yìí ṣe kókó. Bẹ́ẹ̀ ni ó ṣe kókó, ó ṣe pàtàkì. Láyé àtijọ́ ni èèyàn ò mọ irú ẹ̀jẹ̀, èèyàn ò mọ̀ bóyá O positive lèèyàn ní àbí O negative. Nísìnyí ó ṣe kókó, ó sì ṣe pàtàkì nítorí pé gbogbo oríṣiríṣi èròjà ló wà nínú ara tó jẹ́ bí àjẹsára, tó jẹ́ pé tó wá jẹ́ pé irú ẹ̀jẹ̀ báyìí kò gbọ́dọ̀ papọ̀ mọ́ irú ẹ̀jẹ̀ bákan. So we'll be talking more about Rhesus isoimmunization. So once you are Rhesus negative as a potential mother, please make sure you find a way to always get attended by qualified medical practitioners. Yes, I take that again. If you are Rhesus negative, especially as a female of childbearing age, it is very important you find a way to always have access to qualitative and quality healthcare. Why? That is because if peradventure your spouse is Rhesus positive and the child that is forming in your womb is also Rhesus positive, you being Rhesus negative will start producing what we call antibodies against those Rhesus factor that is within the womb. Yes, this is the major thing that becomes a problem, and that is why we are discussing Rhesus isoimmunization today. So if you are Rhesus negative, you are O negative, you are AB negative, you are A negative, you are B negative, it is vital that you find a way to always get attended to by qualified healthcare professionals, because if peradventure your spouse is Rhesus positive and the baby in you is Rhesus positive, there are diverse of things that can happen in the womb that can limit chances of carrying a baby to term. This is not to scare you. This is not to make you agitated or to cause you to be anxious. This is to inform you with quality education, quality information that can help you to give birth to a healthy baby while you yourself is living a very healthy life. So, kan tí mo sọ ni pé téèyàn wá ní irú ẹ̀jẹ̀ tó jẹ́ pé wọ́n sọ pé O negative lèèyàn ní, AB negative lèèyàn ní, A negative lèèyàn ní, àbí B negative lèèyàn ní. Gẹ́gẹ́ bí aláboyún àbí gẹ́gẹ́ bí obìnrin tí ó ti bàlágà tó wá ní olólùfẹ́ àbí ọkọ tó wá jẹ́ A positive lòun àbí B positive tó wà ní ipò ìlóyún, tó wá jẹ́ pọ̀ ọmọ yẹn náà positive yẹn náà ló gbé, torí pé irú ẹ̀jẹ̀ ní Rhesus negative, ó máa ń ṣe kí àwọn ẹ̀jẹ̀ yẹn kó máa gbé nǹkan tó ń tako ara wọn kó máa gbé jáde. Ibi tó dẹ̀ wá burú sí ni pé kò kí n kọ́kọ́ bẹ̀rẹ̀ pẹ̀lú oyún àkọ́kọ́. Oyún àkọ́kọ́ yẹn ó lè filẹ̀ kó jẹ́ pé ibi tí wọ́n ti fẹ́ bímọ ni reaction yẹn ti máa ṣẹlẹ̀, àbí àwọn tí wọn ò bá fẹ́ ọmọ tó wá jẹ́ pé wọ́n yọ ọmọ kúrò, ó jẹ́ pé ibẹ̀ yẹn ló wá ti ṣẹlẹ̀. Á wá di pé ó máa ń ṣòro láti ní oyún mi, àbí kó jẹ́ pé oyún mi tí irú aláboyún yẹn bá ní ó lè ṣòro fún láti bí ọmọ. So gbogbo kíní kò ń ṣe láti bà yín lẹ́rù, kò ń ṣe láti jẹ́ kẹ́ wà ní ìfòyà. Nǹkan tó jẹ́ àwọn ìgbésẹ̀ àti ìlànà tó máa ń jẹ́ kí agbóhùn ìyá ká gbóhùn ọmọ, kí ìyá àti ọmọ wà ní àlàáfíà, gbogbo ẹ̀ ni ó ṣe kókó tí a ó máa tọpinpin ẹ̀ nínú ètò rédíò dókítà orí rédíò tí à ń sọ̀rọ̀ nípa yìí. What are the types of Rhesus isoimmunization? I know that is one of the things that will be on your mind. Like, okay, Rhesus isoimmunization, how is it important? What are the types? So, Rhesus isoimmunization can be categorized into two main types based on the sensitization of the maternal immune system to the Rhesus factor. As I've said earlier, the Rhesus factor is all those B positive, negative, and if you are AB positive, you are A negative as a nursing mother or as a pregnant mother, there is really no issue with this Rhesus isoimmunization. However, there are two major types we'll be discussing. That is the Rhesus incompatibility that occurs according to sensitization during pregnancy, and the one that occurs due to sensitization from previous pregnancies. So Rhesus isommunization is all encompassing with the situation of pregnancy related. So for the sensitization that occurs during pregnancy, this occurs when a pregnant woman who is Rhesus negative is exposed to a Rhesus positive fetal blood during pregnancy or during childbirth, and this sensitization triggers the production of antibodies against the Rhesus factor in the maternal bloodstream, leading to subsequent pregnancies being at risk of Rhesus incompatibility. This is what I've explained earlier, that a woman who is Rhesus negative, once she starts carrying a baby who is Rhesus positive, she starts to produce some antibodies against that. And antibodies, as we know, they're just like fighters that are anti means against those antigens that is within the baby's blood cell. And I've said earlier that first pregnancy really is during the childbirth and everything. The baby is safe, but definitely will be telling you what to do. Peradventure, you got to know your Rhesus factor later. And also there's sensitization from previous pregnancy. In some cases, Rhesus incompatibility arises when a woman who is Rhesus negative becomes sensitized during a previous pregnancy with a Rhesus positive fetus, and subsequent pregnancies with Rhesus positive fetus are at risk of complications that are due to maternal antibodies targeting this Rhesus factor. So this is the one that now gets to be a problem. The first pregnancy, everything moves smoothly, but from the second pregnancy, we start referring to the previous pregnancy. And what are the forms of incompatibility that can happen? What are the things that can happen? Rhesus incompatibility can manifest in various forms depending on the severity of the condition and the stage at which we diagnose it. For example, mild Rhesus incompatibility, as it says, is a mild case. For example, the maternal antibodies do not cause significant harm to the baby, and the condition may even go unnoticed or result in just a mild anemia in the newborn, just a slightly low red blood cell pack cell in the baby, and you say, this is just a mild form of incompatibility. Then there are also some that are moderate. For the moderate type, of course, as it says, these are the moderate cases of Rhesus incompatibility that can lead to a more pronounced hemolytic anemia, and this can result in jaundice, that's the yellowness of the eyes, yellowness of the skin of the baby. This can cause enlarged liver in the baby, and possibly this is what usually require urgent medical intervention. So the mild form, of course, the baby will be fine, smiling, happy baby, pink, everyone is happy. But for the moderate, you can see that maybe in the first 24 hours of the birth of the baby is jaundiced, or peradventure, when they just check the blood level of the baby is a bit pale, and or for example, when they are doing scan for the baby inside the womb, they'll notice, the liver is big, the spleen is big, and all that. And this is where we always need a lot of medical intervention so that we can safeguard the life of the baby, and also so everything can work smoothly even for the mother, because there have been cases of women that have babies undergoing this moderate Rhesus incompatibility, for the mothers to start having swollen feet, for the women to be having some blood pressure issues and everything, or some problems with their urine and all that. And it is very vital that every pregnancy should be adequately registered and monitored in a good health care facility to promote the health of the mother and the baby. The safeguard code we have for management of pregnant women and their babies is Safe Mother, Safe Baby. And in the severe forms of Rhesus incompatibility, these are the ones that, as the name implies, these are the severe cases, and this is the one we actually call Rhesus disease, and this poses a significant risk to the fetus, and they cause life-threatening complications like fetal eye drops. The baby might be swollen when born, the baby might be lifeless, there might be severe anemia in the baby, and even some cases, some baby out are stillbirth, and this is usually when all these conditions of Rhesus isoimmunization is not courted. So nǹkan tí mò ń sọ ni pé ọ̀rọ̀ nípa Rhesus isoimmunization tá à ń sọ pé irú ẹ̀jẹ̀ ni pé tó wá ti ń bẹ̀rẹ̀ pé èèyàn ti di aláboyún, èèyàn ti kọ́kọ́ ní oyún àkọ́kọ́, ó possible pé gbogbo nǹkan tí ó ń jẹ́ Rhesus isoimmunization tá à ń sọ̀rọ̀ yìí pé irú ẹ̀jẹ̀ ò bára wọn mu yìí kò ní kọ́kọ́ ó máa kọ́kọ́ fara sí, ó máa kọ́kọ́ fara pẹ́ síbì kan náà. Ó wá ṣeé ṣe pé oyún kejì, oyún kẹta ni gbogbo àwọn nǹkan tó jẹ mọ́ pé nǹkan bàbàrà ó lè bẹ̀rẹ̀ sí ṣẹlẹ̀ tí èèyàn wá mójútó ipò ìlóyún yẹn dáadáa. So a mọ̀ pé tó wá kọ́kọ́ bẹ̀rẹ̀ náà ó ṣeé ṣe ọmọ yẹn ó lè jẹ́ pé ẹ̀jẹ̀ kò níwọ̀n tó, bí pé nǹkan tá a máa ń pè ní anemia, pé ẹ̀jẹ̀ ẹ̀ lò irú nǹkan bẹ́ẹ̀ yẹn, ìyẹn ni apá kékeré tó fi máa ń bẹ̀rẹ̀. Á dẹ̀ mọ̀ pé tó wá tún gbòòrò sí bóyá nínú ipò ìlóyún, ó lè di pé ọmọ tó máa bí ara ẹ̀ yẹ́lò, ìta ń pè ní jaundice, àbójú ẹ̀ yẹ́lò, àbí irú ẹ̀jẹ̀ ó ti ń lọlẹ̀ gan. Irú yẹn la máa ń pè ní moderate isoimmunization. Táwa dẹ̀ rí pé ìtò lágbára gan, ó ṣeé ṣe kí ó jẹ́ pé ọmọ yẹn máa wú bí balloon báyìí, àbí irú nǹkan bẹ́ẹ̀ yẹn, àbí ọmọ máa gbogbo ẹ̀dọ̀ ìfun, irú nǹkan bẹ́ẹ̀ yẹn, gbogbo ẹ̀ máa wú bákọ̀bákọ̀, gbogbo skin, gbogbo àwọ̀ ara ẹ̀ ó lè wú bákọ̀bákọ̀, àbí kó tiẹ̀ jẹ́ pé ọmọ tí wọ́n bí ó ti ṣaláìsí. So gbogbo kinní yìí ló ṣe kókó tó jẹ́ pé téèyàn wà ní ipò ìlóyún, àbí téèyàn wá tiẹ̀ ti bàlágà, kéèyàn máa mọ irú ẹ̀jẹ̀ tí èèyàn ní. Téèyàn wá dẹ̀ ti fẹ́ ṣe ìgbéyàwó, èèyàn fẹ́ ṣe pé ọkọ báyìí mo fẹ́ fẹ́ o, kéèyàn mọ irú ẹ̀jẹ̀ tí èèyàn ní. So gbogbo kinní ni a ó tún máa tan ìmọ́lẹ̀ sí dáadáa pé rédíò doctor ti sọ̀rọ̀ ọ̀nà àbáyọ wo ni ó wà. So a ó máa sọ̀rọ̀ nípa kí ni àwọn nǹkan tí a lè ṣe gẹ́gẹ́ bí ọ̀nà àbáyọ, kí ni ìgbésẹ̀ tó yẹ ká gbé. So what I'm saying is that we'll be going on a short musical break, and after that we will be able to enlighten you on what can you do when you are Rhesus negative. You are O negative, you are AB negative, you are A negative, you are B negative. What should you do to prevent this condition we call Rhesus isoimmunization? What steps should you take? What proactive steps can you take to safeguard the life of the baby and also to enjoy great health even after getting pregnant? What should you do is what we'll be talking about. So don't turn that dial. A ti sọ̀rọ̀ nípa gbogbo nǹkan tó jẹ mọ́ kí ni nǹkan tó ń fa Rhesus isoimmunization tá a ti ń sọ̀rọ̀ tẹ́lẹ̀ yìí, and what causes Rhesus isoimmunization. We've been able to tell you that once someone is Rhesus negative, that is, maybe you are O negative, you are AB negative, you are A negative, or you are B negative, as your blood group type, you have the chance that when you have a spouse who is maybe Rhesus positive, for example, is AB positive, is AB positive, is O positive, so far there's Rhesus factor that is positive, and there's a baby in the womb that is also Rhesus positive, there's the chance and likelihood of having Rhesus isoimmunization. We've said that the first pregnancy might be spared, though that's usually what triggers the laying the bricks down for the isoimmunization. But the second, third, and subsequent pregnancies, if not well attended to, especially by starting from the first pregnancy, immediately the birth process has taken place and all those things, and you don't get the quality health care, there's a likelihood that one can fall prey of having a Rhesus isoimmunization. We will be able to express that the condition lies from mild, moderate to severe. Mild, or definitely the baby is fine, smiling and everything. Moderate, or the baby may be jaundice, having low blood level and all that. But for the severe form, it can lead to the demise, or what we call mortality, or what we call stillbirth in a newborn being recently given birth to. And for the causes, we know the primary cause of Rhesus isoimmunization is the exposure of a Rhesus negative mother to Rhesus positive fetal blood, and this triggers an immune reaction leading to the production of anti-Rhesus antibodies. And this exposure can occur maybe during pregnancy, during childbirth, or in rare cases, even sometimes it happens as a case of maybe a miscarriage or an abortion. And this sensitization can occur following certain invasive prenatal procedures or even blood transfusion. So don't just limit it to is this way, is that way. You know that for some invasive procedures like amniocentesis is like a condition where they take samples from the amniotic fluids, that's the cold water, the water that breaks, that they take samples from them, or what we call chorionic villus sampling, where they take placenta tissues that are developing to test some things. This can also predispose some people to Rhesus isoimmunization. Even the third stage of labor, because labor has primarily 4 stages. The third stage of labor and everything, if not managed, also can lead to sensitization. Even CS, for example, cesarean section that blood splashes back into the peritoneum, for example, can also be an isoimmunization sensitization procedure. Don't mind me that I said isoimmunization sensitization and it sounded so complex. What it just means is that it can trigger the process of having these antibodies produced. And even in conditions where blood transfusion, for example, especially around the time of pregnancy, that is not so compatible, especially the Rhesus factor, that can also trigger a process of Rhesus isoimmunization. Nǹkan tí mo sọ ni pé ẹ má kọ̀ wé pa báyìí ni o, ó ṣeé ṣe kó jẹ́ pé aláboyún tí ò gbé oyún ẹ̀ dé ipò ìbí, bóyá ọmọ wálẹ̀ ni o and everything, ó sì ṣeé ṣe kó jẹ́ pé ó sún wọn láti ní irú àìlera tá à ń pè ní Rhesus isoimmunization, àbí wọ́n ṣe iṣẹ́ abẹ fẹ́ni ẹni o, ẹ̀jẹ̀ papọ̀ mọ́ra wọn ni o, ó ṣeé ṣe kí wọ́n tún ní irú àìsàn tá à ń pè ní isoimmunization, àbí ó ṣeé ṣe kókò jẹ́ pé ọmọ yẹn wá fúnra ẹ̀ ní o, ibi tí wọ́n ti ń try àti gbọ́mọ jáde ní ipò àkọ́mọ jáde kó rí yọ, kí abímọ, kí ìkejì ọmọ jáde, ó ṣeé ṣe kí nǹkan tá à ń pè ní Rhesus isoimmunization náà kó tún jẹyọ ní irú condition. Àbí aláboyún tó ń gba ẹ̀jẹ̀ tó jẹ́ pé irú ẹ̀jẹ̀ yẹn ò bára wọn mu, irú nǹkan bẹ́ẹ̀ yẹn ó ṣeé ṣe kí irú nǹkan tá à ń pè ní Rhesus isoimmunization kó ṣẹlẹ̀. So what are the management? Because we don't just talk problems, we don't just talk challenges, we give solutions, we proffer solutions and tell you how we as health workers get to manage these conditions. So for the effective management of Rhesus isoimmunization, it involves a combination of preventive measures. Yes, prevention, as I always say on this show, is always better and even cheaper than cure. And also we do a lot of prenatal screening before a woman gives birth. We screen her for all these conditions, and also some medical interventions can be done to minimize the risk of complications for the fetus. For example, there's something we call Rhesus immunoglobulin, what some people call ROGAM. Is a prophylaxis. Prophylaxis means what we give to prevent Rhesus isommunization. So this Rhesus immunoglobulin prophylaxis, when Rhesus negative women are routinely administered this Rhesus immunoglobulin during pregnancy and after childbirth to prevent sensitization in case of exposure to Rhesus positive fetal blood. And this Rhesus immunoglobulin works in a fantastic way that it binds with the Rhesus positive cells in the maternal bloodstream and prevents that maternal immune reaction from mounting an immune response to it. So what is that saying? For example, let's say there's a woman carrying a Rhesus positive baby, she's Rhesus negative, and we administer this dose. It finds a way to bind the reaction that is meant to take place, and so that reaction, that response of antibodies being produced to start fighting the baby, to start causing the jaundice, to start causing the blood level to be low, to start causing the baby to be swelling up, or to cause the death of the baby, is highly prevented. Yes, that is how advanced science is. There's a condition, there's an injection we call ROGAM, Rhesus isoimmunoglobulin, that helps to do that. And also we do a lot of preventive things for them. When you are about, or immediately you get pregnant, we are sure, is it a standard pregnancy? Is the baby implanted in the right place? Because even ectopic pregnancy can also be a trigger for it. So we try to ask all the relevant questions. We try to do all the relevant investigations. Even there we call Doppler scan or Doppler ultrasound, where we check the brain of the baby. Hope there's nothing swelling. We are that detailed when it comes to the management of children that are Rhesus positive, that are being carried by women that are Rhesus negative. And also we do a lot of prenatal screening. We do a lot of that. We do maternal antibody screening, where we take samples and help identify Rhesus incompatibility that is early in pregnancy, and we are able to intervene early, even in cases of established early Rhesus incompatibility. And this test will allow us as health workers to monitor the levels of maternal antibodies and assess the severity of the hemolytic disease in the fetus. And as I always say, prevention is always better than cure. And also we monitor these children. Yes, we do a lot of ultrasound on them, even Doppler ultrasound, as I have said. For example, they check the brain, they check everywhere about the body, they check the tummy, they are sure nothing is swelling. So if you're a pregnant woman that doesn't like scan, definitely you must like scan. Yes, scan is one of the effective ways to make sure that every baby that is being born has all the vital parts that are represented. The baby is as normal as possible. Everything about the baby is forming well, the baby is growing well, the baby is living well, the heart is beating well, and all that. So ultrasound is something that is very vital in monitoring pregnancies generally, and even specifically babies that are Rhesus positive, that are being carried by women that are Rhesus negative. And also we, in some cases, for example, let's say there's a lot of anemia in the baby, we can even transfuse the baby. Yes, babies can actually receive blood components, packed cells in them when they are their blood level is going down due to all this resource incompatibility. So science has gone wide. Science has gone a lot. Science has helped us in managing all these things. So there are some conditions they will say, oh, this woman can't birth children, or she keeps giving birth to stillbirths. Please get the person to the vital health facilities and let the person be adequately managed. Yes, there is need for adequate management. Even the so-called the very late cases, there are some new frontiers of how to manage even cases of someone that has had stillbirth. So science is evolving, and science is here to help man to achieve the best quality of life for everybody. Everybody deserves health. Health is a universal right for you. Health is a universal right for me. Health is a universal right for that child sitting near you. Health is a universal right for that elderly person in your compound. Health is wealth for everybody, and the quality of health of a nation determines the quality of the citizens of that nation. And so there's a lot of planning towards delivery. Yes, we plan and adequately plan towards the delivery of women that we are suspecting or that it has been established to have a case of Rhesus isommunization. Nǹkan tí mò ń sọ ni pé tá bá fẹ́ wo ìtọ́jú Rhesus isommunization tá à ń sọ yìí pé irú ẹ̀jẹ̀ ọmọ kò bá irú ẹ̀jẹ̀ ìyá mu, tó jẹ́ pé a fẹ́ jẹ́ kí a fẹ́ dènà gbogbo nǹkan tó ń jẹ mọ́ pé èèyàn ń bí ọmọ tí kò sí àbí ọmọ tó ń padà. Ọ̀nà tá ti máa ń kọ́kọ́ bẹ̀rẹ̀ ni pé a máa ń fún wọn ní abẹ́rẹ́ kan tí à ń pè ní Rhesus isoimmunization. Àwọn èèyàn míì máa ń pè ní Rogam. Tá bá ti fún wọn ní kinní yìí, ó máa jẹ́ kó jẹ́ pé gbogbo irú ẹ̀jẹ̀ tó ń ṣe báṣubàṣu tó fẹ́ máa dènà ìlera ọmọ ò sí dáadáa ni àbí ó fẹ́ bọmọ jẹ́ ni, á tètè bá wa mójútó irú nǹkan bẹ́ẹ̀ yẹn. Bẹ́ẹ̀ ni ìmọ̀ ìṣègùn ó ń lọ síwájú, ó ń tẹ̀síwájú ní gbogbo ọjọ́ ni. A dẹ̀ mọ̀ pé gbogbo nǹkan tó jẹ mọ́ ìlera, gbogbo nǹkan tó jẹ mọ́ ìlera, òun gángan ní oògùn ọrọ̀. Ó sì jẹ́ nǹkan tí ó tọ́ sí ẹ̀yin, ó tọ́ sí èmi, ó tọ́ sí ọmọdé tó wà ní agbègbè yín, ó tọ́ sí arúgbó tó wà ní fúláàtì yín, ó tọ́ sí ọmọdé, ó tọ́ sí àgbà. Ìlera gangan òun lògùn ọrọ̀. Ìlera dẹ̀ ni a fi ń sọ pé orílẹ̀-èdè yìí orílẹ̀-èdè ńlá ni o. Ìlera gbogbo àwọn tó wà nílùú yẹn ó ṣe kókó, ó sì ṣe pàtàkì, ó sì jẹ́ kí à ń sọ pé quality àwọn orílẹ̀-èdè, a máa rí pé àwọn ìlú kan máa pè ní ìlú ọba, nítorí pé ìlera ara ó jẹ́ nǹkan tó ń mú lọ́kùnkúndùn ni. Kò dẹ̀ ń ṣe gbogbo nǹkan náà la máa fílẹ̀ pé ìjọba kó ṣe lẹ́yìn, ìjọba kó ṣe lẹ́yìn. Pẹ̀lú gbogbo nǹkan tá à ń sọ lórí rédíò yìí, ẹ jẹ́ ká máa mú lò. Ẹ jẹ́ ká máa sọ pé dókítà, mo gbọ́ nípa kínní, irú ẹ̀jẹ̀ wo mo ní, irú ẹ̀jẹ̀ wo mo ní, ká bá lè mọ gbogbo ìgbésẹ̀ tó yẹ ká gbé ká sì lè wà ní ìlera tí ó péye. A sì mọ̀ pé ó ṣeé ṣe fún àwọn èèyàn kan tó jẹ́ pé Rhesus isommunization yìí wọ́n tí mọ̀ lára dáadáa, wọ́n tí nímọ̀ tó péye nípa ẹ̀ka máa túbọ̀ tọ ìmọ́lẹ̀. Àti ẹ̀gbọ́n pé mo gbọ́ nǹkan lórí rédíò doctor, mo gbọ́ nǹkan lórí dókítà orí rédíò, ṣó mọ irú ẹ̀jẹ̀ nǹkan, irú ìbéèrè ráńpẹ́ báyìí ó jẹ́ nǹkan tí ó tún sún gbogbo wa, ó tún sún gbogbo aláboyún àti gbogbo àwọn tó ń retí ọmọ, ó ń sún wọn sí ìgbé ayé àlàáfíà, ó sì ń múnú wọn dùn, ó sì ń jẹ́ kí a lè mọ̀ pé gbogbo nǹkan tó jẹ mọ́ ìlera aláboyún là ń mú ní ọ̀kúnkúndùn. So a máa ń wò pé gbogbo scan, dáhùn sọ pé scan ó ṣe kókó fún gbogbo aláboyún. Kéèyàn má kọ̀ wé pé ó kúkú yọ lọ́run tó ṣe ń ṣe, ó yọ lọ́run tó ṣe ń ṣe. A sì mọ̀ wípé àwọn ìmọ̀ tí Ọlọ́run gbé kalẹ̀ fún wa láti lò, ó ń jẹ́ pé tá a wá lò dáadáa tó ṣe yẹ ká lò, ó máa jẹ́ kí a wà ní ìlera tó péye, ó máa jẹ́ ká wà ní ìlera ara. A sì mọ̀ pé nígbà míì náà tí irú ẹ̀jẹ̀ ọmọ yẹn wá ti lọlẹ̀ gan, a tún máa ń fún ọmọ tó tiẹ̀ wà nínú oyún, a tún lè fún wọn ní ẹ̀jẹ̀ tó máa jẹ́ kí ẹ̀jẹ̀ wọn tún gbẹnu sókè dáadáa, kó má jẹ́ pé wọ́n máa wà ní àìsàn àbí wọ́n máa wà ní àìlera kan. A sì máa ń wò pé gẹ́gẹ́ bí onímọ̀ ṣègùn, ọ̀sẹ̀ báyìí ẹja wò ó ṣe tá a ṣe lè jẹ́ pé ọmọ yẹn a máa bí kó tó di ọ̀sẹ̀ báyìí. Gbogbo kínní ni nǹkan tí a máa ń sújá, gbogbo kínní ni nǹkan tí a máa ń wò papọ̀, tá a máa rí pé ìlera yìí ó a mú ní gbogbogbò ni, a mú láti gbòǹgbò, a sì jẹ́ kí gbogbo aláboyún kó ní ìlera tó péye, tó múnádóko, ìlera tó jẹ́ pé àlàáfíà ọmọ, àlàáfíà ìyá, ó máa jẹ́ ìlera tí ó péye. On that note, I'll be wrapping up by saying that as we explore this medical world, as we explore health, we should make sure that as much as possible, all what you share with you utilize it. All what you share with you share it with other people. All what we share with you, it is what will definitely promote your health. And don't forget to follow us on our social media, on Facebook, on Instagram, on X at WellsRadio 893. And for listeners outside Ibadan or in diaspora, you can always be part of the show by listening live through our website www.wellsradio893.com. Yes, and remember, if you have any health concerns you would like us to discuss, feel free to reach out to us on our email, wellsradiodoctor@gmail.com, or via WhatsApp by texting us on 0915 4999 893. I take that again, 0915 4999 893. And rest assured that we will properly examine your thoughts and your health concerns. Until next time, I am Dr. Tobiloba Ojo, and I won't leave you without sharing this quote with you that encapsulates all what we have discussed today. Having a baby is like falling in love again, both with your husband and your child. That's a quote by Tina Brown. Let me take it again. Having a baby is like falling in love again, both with your husband and your child. And until stay healthy and keep listening to the Radio Doctor.